So I'll introduce Christina Beyer, who's our manager of Controlled Infectious Disease team, and Afsa Rajpuri, who's a health promoter with that team as well. They will be presenting.
Thank you, Dr. Virgin. Welcome. To start with your presentation.
Thank you so much for the introductions, and thank you very much for being here today. The Controlled Infectious Disease team is part of the Health Division, and we're going to be speaking about measles, as Dr. Karaji mentioned. We're going to speak about what we did in terms of preparedness, as well as how we were able to respond to our we had in July and August. So measles is a disease of public health significance. It is highly contagious, as well as is highly contagious and can lead to severe complications and death. It often starts with respiratory symptoms, such as fever, cough, runny nose, but then progresses over a few days into more of the classic signs that we are more used to hearing about, such as the redness of the eyes, the cough spots, which is the white dots in the mouth, and then our classic rash, which is the raised. It is primarily spread through aerosolization, so when somebody breathes out, and can stay up into the air up to 2 hours after someone has even left that area. So, for example, if I had measles today, all of you, if you were unimmunized, would be at risk. If a cleaner or staff came into this room or into the area I had been within 2 hours after I had left, also unimmunized, they would also be at risk as well to contract. 90% of unimmunized are those who are not previously infected and be infected with measles if they are exposed. So because this disease is highly transmissible, it can spread easily, it is a concern to public health, which is why we did our preparation pieces to ensure that we were able to act in a timely manner if a case arises.
Measles infections have been rising over the last several years. In 2023, there were an estimated 107,500 measles-related deaths, according to the World Health Organization around the world, and mostly in children. In Canada, as you can see in the graph in front of you, measles infections have occurred sporadically since its elimination in 1998, and usually due to importation from regions where measles exists. In Ontario, similarly, measles has historically been a rare disease, owing to the successful elimination of measles as well as high vaccination coverage. However, in 2023, due to the rising activity of measles around the world, Ontario also started seeing more infections. Ontario is also currently part of a multi-jurisdictional outbreak. And the first infections of this outbreak occurred in the week of October 28, 2024. At Public Health, we have been monitoring trends and started thinking about our planning. The measles response plan was developed in 2020, and as such, the level of response to a measles threat will vary depending on the scale of it. Internally, measles planning was really a collaborative effort between divisions and team across the agency. We updated the measles website content. We developed case and outbreak communications, including news releases, advisory alerts, media response. We also planned for a call center and a dedicated phone line. An online measles survey was developed to provide accurate and evidence-based information to the public, and as well as increase our call volume. Training for staff also occurred. On-call staff were trained for a measles response, and public health nurses across the agency were also trained for the administration of immunoglobulin. In terms of external planning, a measles preparedness letter was sent to schools, summer camps, and the bus consortium. Hospitals in the service area were notified of the risk. Together with primary care providers, we developed an emergency preventive treatment community pathway. Now, the emergency preventive treatment for measles contact is time sensitive, and as such, it is important to have such a community pathway for the rapid coordination and administration of vaccination and immunoglobulin. And finally, we also plan for the distribution of intramuscular immunoglobulin with our health system partners.
Our outbreak. In July 21st, 2025, we were reported our first case of measles. This was our first case since 2014. Because of the resources we had already created, we were able to quickly provide a news release to our public, notifying them of our first case. In response to our first case, we also operationalized our measles response plan. We brought together a table of staff, various staff, managers, directors, MOH and AMOH to support our next steps. The table really, when I say our table really did consist of all programs, knowledge introduced services, our Indigenous Public Health Division, our health promotion, vaccine preventable disease, and our health protection division in our corporate services. It really was a utilizing our resources we had already created, as I mentioned, we were able to quickly notify our key partners, such as our First Nations communities, and our health system partners. We were able to mobilize our emergency preventative treatment pathway, so specifically notifying Manitoba and Helsingør, ensuring that they had the resources that they required for the outbreak. We also identified media spokes individuals to provide the key messages that we had already developed. So thank you to Dr. Turji and AFSA, who are our. We also launched the measles assessment tool and our call line. The measles assessment tool was initially, the idea came from Southwestern Public Health. One of the key things that other health units had shared with us in response to the measles was that the call volume, because from the community members with concerns and questions for teen meals, was quite high. And so we wanted to really be able to provide service to our public members by answering their questions in a timely fashion and concerns, but also wanted to mitigate the impact on us to ensure that we could provide case and contact management in a timely fashion as well. So the measles assessment tool, it had 487 hits. So, and the call line itself had 20 measles specific calls. So it really showed that those tools really did help meet the community needs. The call line was run by trained staff to be able to answer those questions. We also redeployed staff to support case and contact management from other teams. And it would be initiating the case and contact management. We also really tailored it to, we tailored specific approaches such as home visits to offer immunizations, testing, and ensuring that cases. Through our case and contact management, in subsequent to our index case, we identified 44 additional cases. This cluster of cases, they were all interconnected, transmission mostly spreading through private gatherings. The transmission actually had started to occur 7 weeks prior to when we were first notified. So this really shows how quickly measles can spread amongst communities. We also identified that this cluster did link back to the multi-interjurisdictional outbreak. So in response to these discoveries, we did issue a second news release to again share this information with our public members. In terms of the current situation, our outbreak is under final evaluation at this present time. In terms of the Ontario and the interjurisdictional Ontario outbreak, they have reported 2,373 measles cases associated with the multi-interjurisdictional outbreak. What the current trend is showing, though, is a positive, and it is on a downward trend. So hopefully this is good news for us and within our jurisdiction as well. Internally, in terms of next steps in our response plan, our plan is to evaluate and debrief our current plan, what worked, what didn't work, can things be streamlined, can they be improved, and what lessons can we apply to other infectious diseases. So with that, I thank you very much for your time once again, and I'll turn it over to you, Mr.
Thank you for the presentation. I'll ask the board members if there's any questions for the presenters, whether online or in person. Can't see online. So, is there anyone online just before I go to that? Go ahead, Alan.
For you, Mr. Chair, out of curiosity, are we tracking, or is Canada tracking data with respect to serious measles complications? And of the 44, were there serious measles complications for our outbreak? We know.
Let's answer that question.
So measles can cause serious complications. We do know that one was hospitalized, fully recovered, which is fantastic news.
Yeah.
In terms of long-term complications, we were reported for 22 hours. I'll turn it to Afsa. She has that interest.
So in terms of the provincial outbreak, the multi-jurisdictional outbreak, about 27.7% individuals were hospitalized. Sorry, I'm looking at the wrong. There were 7% who were hospitalized, and 0.5% were admitted in the ICU, and one death. One individual had measles.
Follow-up, yes.
Are we using this to try and encourage vaccination? Because there's still that stigma that, oh, measles is just a childhood disease. It's not serious. We're trying to break through that barrier for vaccination so that we don't lose our endemic status.
Thanks for that question.
We're always trying to promote vaccination. I think this is definitely a highlight that we can continue to advocate for in terms of vaccinations. And it's not just measles as severe complications. We've seen meningitis and specific as well too that can cause all those diseases. Need province, the country, that vaccinations are still a key prevention strategy.
Sure, if I can just add on to that answer, absolutely, we do highlight this as some of the risks that if you could suffer with not being vaccinated. Our experience is that while some people don't appreciate the risks, usually the much bigger problem is all the misinformation that's being created about false risks of getting the vaccine. So that's really where I think more of our effort focuses. We really try to have those conversations done one-on-one because I think that creates a dynamic where you can really explore what are someone's true fears and really help work through some of those. We are cautious, to highlight, we don't want to be using the tragic story of someone dying as, now a tool that we're going to use to, promote the vaccination, but we do bring it up where it is appropriate.
Is there any other questions? Thank you both for your presentation. For the detailed response. Look, fortunately, we just had one, but could have been worse. So thank you for that.